Hi everybody, Diana Del Garbino with Muscles in Motion for this week's Principles of Fitness. So we had quite a few questions this last week come up, and one of them is, can you work out with pain reliever or alcohol in your system? So let's talk about that. What do those things do? What do pain relievers and alcohol do in the system? Is they block pain, right? So they're stopping you from feeling what's happening. Alcohol, too much alcohol, even a little bit of alcohol is going to dull those nerves. You're not going to feel things. Pain relievers do the very same thing. So that is going to hinder your workout. What's going to happen is you're going to start working out. You're not going to feel when you get that burning sensation. Your body's not going to register, your brain is not going to register that your body is feeling that you're getting to the end, and you're going to push through. So your chances of getting injured are increased greatly. It also is going to make you way more sore. Alcohol can dehydrate the tissue, so we want to keep as much water in there as possible. So it is not a good idea to come in for your workout if you've taken Advil, aspirin, Vicodin, any of those things that you might need. Use them later when you're not going to work out, but make sure you don't have alcohol or pain relievers in your system to work out, because we want you to get the best workout that you can. We don't want you to get injured. We don't want you to be overly sore because you've overworked that tissue. So make sure of that. Number two is, why continue working out after a joint replacement? So we have a lot of folks that come in to Muscles in Motion that are in need of knee replacements, hip replacements, shoulder replacements. So they get themselves as strong as possible with as great a range of motion as possible, so that when they do have the joint replaced, everything works better. So they're stronger, they can lift their own body weight, they can pick themselves up, they can move their arms, everything. But then they say, well, I got it replaced, so I did a little physical therapy and now I'm fine. So let's talk about what happens before and after a joint replacement. So if I have a bad shoulder and I can no longer lift my arm in full range of motion, I can only lift it to here, and I've had it that way for months and months and months, the muscles are going to start to atrophy. They're going to start to shrink. So when I get my joint replaced, the muscle, they can only attach it as far as that muscle can go. So my arm is not going to automatically have full range of motion again. It's only going to have the range of motion that I had prior to working out, which is why we try to work through as much range of motion as we can, so that your joints and your muscles, so you're going to get that joint replaced, but your muscles are now in a better position to have a greater range of motion, to be better, to be more fluid. Then you get done and you have to stop doing a lot of things because it's got to heal for a while, so that's going to cause more atrophy. And then you're starting to overuse one side, because let's say I replace my right shoulder, I'm going to have to keep my arm in this position for quite a few weeks. So now I'm overusing that left side. So working out after you replace that joint is just going to give you more strength and balance you out. It takes up to a year of recovery once you have a joint replaced. So just because the pain is gone does not mean that all those muscle fibers and ligaments and everything that they've done in there is not still getting healed. And so by working the muscles and keeping everything stronger, it helps your lymphatic system drain whatever swelling is in there, because when we work out, that's what's happening. You are contracting the muscle, it's helping those fluids get out of the area that was just replaced. It's also going to help keep everything strong, because in physical therapy, those people are wonderful and we love, love, love working with them. We have quite a few that we work with. I think they're just fantastic, but they're limited to working the area that you had replaced. They don't get to work the whole body. So we will work to keep the rest of you strong, and then once that joint, that part is able to now get cleared to start working out, we're going to integrate that back in and make sure that there isn't a new imbalance. I have seen this before. I've had people come in that said, oh, like 10 years ago I had this one replaced, but then When I was having that one done, I hurt my left one because I overworked it and I overdid it, and I never worked out before that. So now I'm having my other joint replaced because I did so much damage. So we don't want that to happen. We want to keep you as balanced for as long as possible. And working out is good for you. I mean, that's just the bottom line. Working out has so many benefits to it that come even after if your whole focus is just about a joint replacement. It's keeping you moving. It's keeping as much muscle tissue on your body as possible, especially as we age. It's more important than ever because we're becoming a society that is sitting so much that we're getting, the hip joints are getting osteoporosis, our spine is getting osteoporosis, and the only way to combat that without taking terrible medications that make people sick is to do resistance exercise, and that's what we do here. So it's really not just a matter of healing from that joint replacement, but making sure that you stay strong for the rest of your life. So that's my take on having a joint replacement and why you need to continue working out. Another question is, why are the hips so important to keep strong? This is probably my favorite thing to work on with men and women. So if you look at the human body, the hips are right around the center. So if I'm standing straight up and my shoulders are squared up, if my hip goes over, everything shifts. So if my hip is weak and I cannot hold myself standing straight up and I have to rock my hip to the side because of a weakness, it's going to throw off my upper body and it's going to throw off my lower body. So I look at it that whatever happens in the hips goes up the chain or goes down the chain. So it can affect my knees and my ankles at the bottom, and it can affect my thoracic spine, my shoulders, my elbows, and my wrists on the way up. So I want to make sure that this part is strong. Now for the runners and the golfers, this is probably one of the most important places that you can work out. If I cannot stand on one foot because I have this weakness, if I'm running, I have to be able to somehow keep that really strong so that my back is not getting shifted with every step. Golfers have to rotate and twist and shift their weight. If their hips are weak, that's going to be a problem. I know men don't always like to work their hips. We have that inner and outer thigh, and I hear it all the time. Well, it's a girl machine. That's the one my wife works on, or my girlfriend. No, it's for everybody. It is gender neutral. All of our equipment in here is gender neutral, so we want to make sure that we keep those hips strong. The outer thigh, the inner thigh, if you don't have that control, all of those muscles attach into the hips that go up into the back. Everything is connected in the body. So it's really important that the center of us, the glutes, the glute medius, the hamstrings, the quads, all of that is going to stay really strong. The inner thigh attach into the abs, so they're actually part of that. So we want to make sure that we keep that inner thigh really strong because we want you to be healthy. We want you to be able to have good balance. This is one of the other things of keeping the hips. If you don't have good balance, it's probably because you're not balanced in your hips. So you're shifting from side to side, and then that throws off your ability to have what's called proprioception and knowing what's happening below where your eyes cannot see. It's your feel balance. So we want to keep those really strong. We want to keep the legs really strong and keep everybody walking and moving and doing the things that they want to do. If you're out hiking, your joints and your hips are going to be equally as important as keeping your quads strong. So imagine that if your hips are not strong enough to keep you centered, then all that pressure is going to go on your knees, and this is why a lot of people have their knees hurting when they're walking downhill or going downstairs. They're hiking downwards because those hips are not doing their part. So we want to keep everything working together and keep you all as healthy as possible. So